Welcome to another episode of Medicine in Small Doses with Dr. Amobi. I'm your host, Uju, and today we're delving into a topic that deeply affects the lives of many, especially within the African community. If it's your first time tuning in, then Dr. Amobi is a general practitioner, a health coach, speaker, lifestyle medicine consultant, and a dedicated force in enhancing health across Africa. Today's focus is arthritis. And Dr. Amobi, as always, it's a great pleasure to speak to you.
Thank you.
So could you start us off by unraveling the mysteries of arthritis? What exactly is arthritis and what are the different types that exist?
So when it comes to arthritis, it's an umbrella term for various types of joint problems. There's like about over 100 types of arthritis. So arthritis, the name encompasses lots and lots of very different types of arthritis. So the commonest one, for example, is osteoarthritis. And we have rheumatoid arthritis, we got psoriatic arthritis, we got gout arthritis, we got so many of them. But they uniquely affect the body in their own different ways. And what's important to remember is arthritis doesn't discriminate. So it touches the life across all ages. So children can actually have juvenile arthritis across genders, races, and often, one of the things is that it's one of the leading causes of disability across all the medical health issues. So in my estimation, I think it should be taken as seriously as we take diabetes and heart disease.
Very interesting. What is osteoarthritis? As you mentioned in previous lectures and just now, it's more prevalent in Black individuals. Can you elaborate on why this is the case and the factors that contribute to it?
Yes. So osteoarthritis. So the best way I is explaining in clinical practice. So if you get a joint, inside this joint, there will be a tissue in there that's called a cartilage. The role of the cartilage is to provide a cushioning effect. Imagine like in Africa, when you're building houses, you put like a block, you put cement, you put block, right? So the cement part between the two blocks are like the cushion to prevent those blocks from touching each other, because we know that block on block will start eating each other away. So the cushion in the cartilage is that cushion that prevents the bones from rubbing against each other. So osteoarthritis means that cement, that cushioning has broken down. So bones start rubbing on each other. Then it becoming very difficult to move. It causes pain. It can cause swelling. And so it is, to some capacity, especially people who have a very severe form of it, it can be very, very painful. So in a nutshell, that is what osteoarthritis is. Now, why is osteoarthritis more prevalent in Black individuals compared to other forms of arthritis? Well, there's so many reasons. Number one is, of course, it's quite difficult to adjudicate, especially within the African community, because people who live in Africa versus like the Africans in diaspora, we know that they have some similarities in the sense that our cultural perception of pain, right? So there's a widespread belief, and this is based on, like I said, stereotypes or actual truth, that Black individuals have a higher pain tolerance. And this leads to underreporting of the symptoms. And as a consequence, there's a delay in seeking medical treatment. And again, that leads into reluctance to seek medical treatment. Again, because in Nigeria or in Africa at large, most people pay for their healthcare system, right? So individuals might hesitate to see a doctor, which leads to delay in diagnosing arthritis as well. And then you're looking at why would somebody be delaying going to see a doctor as a consequence of getting pain in their joint area? Well, financial constraints, because if you have limited financial resources, it can make accessing the healthcare, including treatment of arthritis difficult for Black people. And this is more so true for people who live in the US and Africa, as opposed to in the UK, where most treatments are covered by the National Health Service. And then there's a misconception of arthritis. There's this misconception that it's a natural consequence of aging. So provided you're getting old, you will have to have arthritis. And that may equally as well, delay people for going to sick care. Mm-hmm. Another thing I tend to notice as well is, like, I call it exercise apprehension, is this belief that exercise worsens arthritis. And people stop exercising and they don't see the benefit of it, and people evade that. And then you look into dietary things, people may not even associate like processed food as a lifestyle that can increase your risk of developing arthritis. So there's so many things that our lifestyles as Black people puts us at risk of developing arthritis because we're not seeking help early, and all these things that I've just mentioned.
Excellent. You've touched on the pieces that contribute to osteoarthritis prevalence in Black individuals. Could you elaborate on the genetic and lifestyle factors that interplay in this scenario?
Yeah. When it comes to osteoarthritis, we don't know exactly what causes it. Mm-hmm. But there's several factors that we believe that increase your likelihood of developing osteoarthritis. We know that people who use their joint excessively, as you would expect, though, when they have like repeated injuries, or people who've had surgery in their joints before, the risk of osteoarthritis is greater. There's some other conditions as well, like inflammatory diseases, like diabetes, like gout, that can cause or increase your risk of developing osteoarthritis. When it comes to age and gender, the risk of developing osteoarthritis goes up as you get older. But one of the things that is quite interesting from the WHO is that osteoarthritis, of course, it predominantly affects older people, with about 73% of those being people who are 55 and over. But what you may find interesting is that 60% of the sufferers are women. And the most commonly affected joint is your knee, and I think it's followed by the hip and then the hand. Mm-hmm. And you mentioned earlier in your question about genetic risk factors. We know that osteoarthritis might have a genetic component as well, and it can run in families, although we haven't identified exactly what gene that is causing this problem. Yeah. So now I want to put this into better perspective so that it makes sense to some capacity. Because your knee, I think the knee takes about almost 50 to 60% of the whole of the arthritis, if that's not wrong, but I am quite confident that it is. And as a healthy person now, when a healthy person or a healthy person with a normal healthy weight walks, like yourself, mm-hmm. your knee can handle about 1.5 pounds of force each step that you take. So every step that you take, you are actually pounding on that knee. I'm not saying you shouldn't walk, but if you're normal weight, 1.5 pounds per each step, that's a force of its own, because your knee carries almost the bulk of your whole body, right? If you're climbing upstairs, if you're picking up something from the floor, that weight actually increases some more. So if you are overweight by, let's say, 4.5 kilogram overweight, every step that you take, you are adding between 7 to 22 kilograms on top of it. That's between 15 and 50 pounds. And that's the amount of pressure that you're putting on your knee. And the impact doesn't stop there if you're overweight, because we know that fat is a living cell. And because it causes inflammation, it actually increases your risk of eating up those cartilages and increases inflammation in your joint. And it causes itself a pressure because you're carrying a load as well. So what am I saying in effect? If you're overweight, you are more likely to have arthritis. Mm-hmm. If you're overweight as well, your risk, if you have arthritis in one knee, you are 5 times more likely to develop in the other knee compared to somebody with the normal weight. Because it's just pure, simple science. Your knee taking a lot of battering. You're giving it's like using like a Toyota to tow a much, much heavier something. You know what I mean? So the engine is going to, like, at some point become frazzled. So the essence here is there's nothing that leads more significantly to arthritis than excess weight. So I hope that makes sense.
It does indeed. Let's talk about lifestyle changes, because we do strive to empower our listeners. So can you provide some actionable steps? What lifestyle changes can our audience start incorporating today to support their joint health and potentially mitigate the impact of osteoarthritis?
Good question. I want to do this a bit differently. So I want us to use like a case scenario. Let's develop a case scenario. So let's say, for example, because I want audience, if you're listening to this, I want this to be very useful for you so they can see from my perspective how I would typically manage somebody who got osteoarthritis in clinical practice. You ready for it?
Let's go.
Cool. So we come up with a patient name. Let's say her name is Mrs. Okafor, right? Mm-hmm. So Mrs. Okafor, for example, she is 64 years old. She shows up in your clinic, and then she has been, battling with arthritis for many years. And she comes to me. I remember this is a patient we made up at the spot. So we're going to pretend as I've seen this patient, right? Mm-hmm. So, and the reason is this, because I've seen thousands of, African moms and dads. And remember, like we said, a significant proportion of women would have arthritis. It's more than men. So this is Mrs. Okafor now in my clinic. So this is how they normally start. Hey, Dr. Amobi, I don't know what is happening. I'm struggling a lot with this arthritis. I don't understand this nonsense. I've had this problem now for 5-6 years. Nobody seems to be knowing what to do with me. What kind of punishment is this that I'm experiencing? I wake up in the morning, I'm in pain. I go to bed, I'm in pain. I try to have shower, I'm in pain. I try to even eat. Now, the arthritis is no longer in my hip. Now it's in my knee. Now I start feeling something in my hand. What type of disease is this one? Because my son, your auntie, I'm in trouble. I've done everything right in my life. I go to church, I've prayed, I even left my church self and go to a new one. So, my dear Biko, just help me, advise me on what to do. Because I'm tired of this problem. It's not fair. Now, when somebody comes in with something like this, of course, the first thing in your head is she is in trouble. She's going through a lot. Arthritis can be painful. It's just about one of the most painful experiences that you get. And this is not different from how most moms or most aunties will, present to the doctors. And one of the most important things I always do in clinical practice, I will ask people, because I believe that knowledge is power. So you say to them, okay, so let's say in this case of Mrs. Okafor. So Mrs. Okafor, so walk me through what you understand by osteoarthritis. My dear, it's a sign of aging, ain't it? Yeah. And so we tend to see that a lot in people who are older. So what exactly is it? What do you think is happening at your joint? And most people, not just Mrs. Okafor, I would say about 80% of my patients may not know the answer of exactly what is happening in osteoarthritis. And the reason I'm referencing this is because for you to actually get better, you need to understand exactly what is going on with you. And that's one of the reasons why we did this talk, to see how we can educate people to understand why. Why am I getting this pain? You're getting this pain. Of course, in women, we know that during the time that you're having your period, we know that estrogen, which is the primary female hormone, helps to improve your bone strength, cushioning the cartilage as we talked about. But we know after menopause, that function actually decreases. And we know as well that our women are more likely to be overweight. There's so many other factors that overrides on it. So if you know the things that are more likely to lead to you developing arthritis, avoiding them is super important, right? So for me as a health coach, what's the first step that I normally take? The first step is my number one is I assess people's understanding. So I'll ask Mrs. Okafor, what exactly is arthritis? Now, two is, how ready are you to do something about it? And some of the things I experience in clinical practice is people always expect like the magic tablet. Give me something so that I can start walking as normal. It doesn't work like that. So you need to recognize where you are. Okay, it's been debilitating for the past 5 years. What has worked over the past 5 years so that we can do more of what's working, and then we do less of what's not working, or change what's not working and then have a plan moving forward, right? So let's say, for example, exercise. Is she ready to begin with slow, gentle movements? Is she ready to increase her exercise and physical activity, let's say, right? So those are the important things that I would typically, normal to start with, because we know that with physical activity, you're not only strengthening the muscles around the affected joint, you reduce bone loss, you reduce swelling, you reduce pain. It actually can replenish the lubrication in the cartilage area, which will make the joint less stiff. You get energy, you get improved stamina. It's good for your overall health anyway. So it's important from the exercise part, and your body releases natural painkillers called endorphins that will improve your pain as it is. So it depends on what exactly are you willing to do, because number one, you're in pain. I know very sensible questions I always get in clinical practice. How do you expect me to do exercise with this amount of pain that I'm in? Sensible question, right? Because some people may try to take like painkillers an hour or so before they do some exercise to reduce that. Because the question you got to ask yourself is, if you're in a lot of pain and this pain is exactly how it is now between the next 5 years, does that mean that you're not going to exercise more? In the next 5 years, you're going to be 5 years older. Do you think it's going to get better or worse? So you're stuck within a rock and a hard place, but you still got option to move. You still got an option to do small things to improve your health, because it's hell to do an exercise, but it's going to be even more of a hell if you don't do anything about it. All right. And the next one I'm going to go to now is diet, because
of course, yeah.
One of the things, so let's say we're exploring lifestyle for Mrs. Okafor in this instance. So the next thing I will ask Mrs. Okafor is, what are your thoughts about food? How are you managing to eat? Because these things you need to understand that there are certain types of food that people eat that increases inflammation in their body.
Just out of interest, Doctor, sorry to interrupt you, would you recommend changing your food and making these lifestyle changes at the same time, or does it not really matter? Just like, I'm starting to exercise and I'm starting to change my diet.
Yeah.
Or should I try and just focus on the food element first? I don't know.
Yeah, I think everything's one step at a time. Do what you think that you can do and that is achievable and that you can maintain. And then always say to yourself that today has to be better than yesterday. Tomorrow will be better than today. So let's say, for example, you manage to walk for like 5 minutes, down the road. Tomorrow, aim for 6. Next day, aim for 7. If the worst comes, go back to 5, but you can never go beyond 5. So that at least you have a threshold to which you would have to push. You cannot go below 5. You have to promise yourself that, right? So if you want to augment it, if you want to do a little bit more extra, then you can always, like, in terms of food. And that's a very important question, because I had a lady in my clinic. One of the difficulties she had was she was ordering a lot of processed foods, like takeaways. And she would buy foods that from already made foods. So all she had to do just basically poke holes in them and put in the microwave. And I said to her, like, have you ever imagined that this food can be in freezer for like a whole month? What is keeping it that alive, that the vegetable looks exactly the same way for the past 1 month? She goes, no. I was like, because chemicals are put in these foods to keep them fresh. So, and these chemicals can cause inflammation in your joint. So effectively, the question is, what can you do in your kitchen to make life a lot easier for you? And what actually emerged was the what do you call that thing? You know, like when you she struggles to reach where her condiments are kept in her cupboard, right? And it's something as small as, okay, get a stool, not even a stool, get some packaging that you can put on your counter that your hand can reach it quite easily. So small modifications at your home. Some people struggle with having shower, right? You go, okay, cool. Why not take a small stool, sit in the bath, and then have a shower? So think about what are the and think these changes don't have to be like nuclear. You can go very small, very little. Audit your life and say to yourself, okay, these are the areas that I'm struggling so much. What can I do to improve them? That's the aim, right? So when it comes to food, one of the things I did for this patient I was telling you, not Mrs. Okafor in this instance, but for the patient that we talked more about her food, was even though she's not willing to change the frozen packaged food, I said to her, okay, cool. So if you're going to do that, then why not add vegetables, new fresh vegetables to that stuff that you're eating, right? So at least you're getting something decent. Add some nuts in it, add some pulses, add beans. If you buy like frozen rice, why not like get beans? Even if they canned beans, it's better than nothing, right? So why not add some oily fish in it while you're at it? Why not add some extra virgin olive oil, like about 2 or 3 tablespoons? Just drape it over the food, because we know that that's a good fat. So all these small little things that people can do will help. Drink water, drink plenty of water, keep hydrated. Those are very, very important. And then make a food diary. One of the things that actually emerged in another patient that I saw was that there's certain food that she eats that will make her arthritis worse. And we figured this out by her keeping like a 2-month journal of all the food, whatever food that goes through her mouth, she writes them down. And she was able to pinpoint the ones that actually affects her arthritis as it is. Yeah.
Wow.
So, and then things other people have found, some of my patients find useful is like green tea. Some of them felt that it was beneficial to their arthritis. Vitamin D is important. In my estimation, just about the most important vitamin on the planet. And what I found very interesting was one of my colleagues in Nigeria told me how many people in Nigeria who are vitamin D deficient, that we get our vitamin D from sun. And Africa is hot most times than not. But people are still deficient on vitamin D. It was astonishing. Mm-hmm. So it's very important that we keep up our vitamin D levels. So again, some of the really good foods, leafy greens, fatty fish, all of those things contain vitamin D. So fiber is super important, because we know that studies have suggested that it can reduce the symptoms of osteoarthritis, right? Blueberries, raspberries, strawberries, all the berries, and things like pomegranates can actually help with osteoarthritis as well. But of course, make sure that if you're buying them, they haven't added some pesticides. And if you have access to organic ones, that would even be better. Wash them thoroughly as much as you can to be able to utilize them, because so that you don't eat something to gain a benefit and then develop another problem on the other side. Garlic is good, onions is good, leek, all of them have been linked to potential reduction in progression. So, the most important thing here is everybody's arthritis is unique. The experience is going to be unique. So always make sure that you consult your doctor with whatever lifestyle or exercise or diet, whatever change that you want to make. Make sure that you're doing it with your doctor. It's super important and cannot be understated. Sorry, I've just waffled on that one, but I was quite keen to...
No, that was amazing. It's good to get some tangible information that people can practically use. And that's how we want to empower the listeners on the show. So just before we conclude, is there anything that you want to really highlight as a takeaway for the listeners?
I think takeaway is arthritis is a big deal. It can be debilitating. It can be disabling. There is always a way. And that way is you need to be prepared to fight. And there is help out there. Even if you start small, if you believe that you're going to get better, you will get better. Because you'll be able to push yourself. You'll be able to incorporate lifestyles that will make life a bit easier for you. But it's not going to be very easy. It's going to be a tough job, but you will get there.
Brilliant. Thank you, Dr. Amobi, for sharing your wisdom and continuing to guide us towards better health for our listeners. To the listeners, continue to stay curious, stay empowered, and keep tuning in to Medicine in Small Doses. Until next time, remember as always to like our podcast, to share the podcast so more people can find it, and please leave us a 5-star review on Apple Podcasts. Again, this helps more people to find the podcast and benefit from the information on the show. Until next time.